People are suffering in hospital. We know that, we accept that. But should some people be suffering more than others? People with dementia are suffering more. These are people who might be fine in their own home, but bring them into hospital with the bright lights and people invading their personal space, and it can increase their confusion and increase their chance of getting complications. My research found that people with dementia were 2 to 3 times as likely to get a complication while in hospital. These are things that we can prevent, like pneumonia, urinary tract infections, pressure areas, and delirium. Just these 4 common complications are expensive. I found that in one state, in 1 year, they cost a quarter of the extra length of stay. That's $225 million. So what is happening to people with dementia while they're in hospital? Well, I'm a nurse and I work in hospitals. And for Bob over here, we're going to give him a blood transfusion because we're concerned about the oxygenation going to his brain. Then for Mary over here, she's been crying out in pain. I need to double check some morphine with another nurse to try and decrease that pain from her cancer. Then over here, we've got Peter, who's had an failed inguinal hernia repair. We need to urgently get him some IV antibiotics. And then I remember Mrs. Murphy. Mrs. Murphy, do you remember me? I'm your nurse from this morning. Yes, you said you needed to go to the bathroom about an hour ago. Come along. I like to walk Mrs. Murphy to the bathroom rather than, say, panning her in bed, because I know that this mobilisation decreases her chance of getting urinary tract infection. By being oriented to where the toilet is, she's got a decreased chance of getting delirium. By expanding her lungs while she walks, she's got a decreased chance of getting pneumonia, and the increased circulation decreases her chance of getting a pressure injury. Just sit there for me, Mrs. Murphy, and press that button for me when you've finished. Nurses have to prioritise their care. It's a normal part of healthcare delivery called healthcare rationing, when we have to manage numerous people with finite resources. But when care is delayed for people like Mrs. Murphy day after day, well then no wonder people with dementia get more complications. Their care might take longer, it might be a little less life-threatening, it can also be more unpredictable. Mrs. Murphy, I said to press the button, don't go in that room, it's infectious. Oh no, don't fall over. There will only be more Mrs. Murphys. Dementia prevalence is increasing. But now that I've found a way to measure and cost nursing care, we can move forward and determine if this is how we want to be rationing our care and reduce costs and suffering. Thank you.